Two questions that we frequently hear at our agency are, what is a Medicare supplement and do I need one? A Medicare supplement is a type of health insurance policy sold by private insurers to cover the gaps in traditional Medicare coverage, Medicare A and B. An easy way to think of a Medicare supplement is to picture it as an insurance card that sort of bolts onto the back of your original Medicare and pays for costs that Medicare would normally pass on to you. Medicare has gaps like coinsurance, copayments, and deductibles that you must pay for when accessing medically approved services. If you have a Medicare supplement, Medicare will first pay its share of your medical expenses, and then your Medicare supplement will step in and pay its share. This is usually the remainder of your whole bill, but it depends on which Medicare supplement policy you choose. Every Medicare supplement has to match the outlines created by Medicare itself when it standardized these plans back in 1990. Each standardized Medicare supplement is identified by a letter, such as A, B, C, D, F, G, K, L, M, and N. Each one of these lettered policies is required to provide the same basic benefits regardless of the insurance company that sells the policy. This means that price or monthly premiums are really the only difference between Medicare supplements with the same letter offered by multiple insurance carriers. Perhaps the most confusing thing about Medicare supplements is the terminology. So let's take a look at the benefits as described by Medicare, starting with your Medicare Part A coinsurance. All Medicare supplements offer this benefit. It covers the very expensive daily hospital co-pays that you begin accruing after your 60th day in the hospital, and even pays for up to 365 additional days of hospital coverage after Medicare has stopped paying. Every Medicare supplement also covers the Medicare Part B coinsurance or copayment, which is one of the most important benefits. Generally, since Medicare only covers 80% of your Medicare Part B outpatient expenses, this benefit is what pays the other 20% for you. This can be crucial for high-ticket items like cancer treatment or dialysis. This benefit, which is also covered under every Medicare supplement, pays for the first 3 pints of blood in a blood transfusion, since Medicare only pays for the 4th pint and above. Blood is very expensive, so this is a good benefit. Under the Part A hospice coinsurance or copayments benefit, Medicare supplements pay for the hospice expenses that Medicare doesn't. And some supplements also offer a skilled nursing facility coinsurance benefit. Medicare allows for 100 days of skilled nursing facility care after you've been in a hospital and need nursing care while you recover. However, Medicare only pays the entire cost for the first 20 days. A Medicare supplement with skilled nursing facility coverage will pay for the other 80 days. The Medicare Part A deductible in 2012 is $1,156. You will pay this each time you access Part A benefits, such as inpatient hospital stays, when you have not been in the hospital for the previous 60 days. Some supplements pay this bill for you. In 2012, the Medicare Part B deductible is $140 per year. You will pay this deductible once per year for services like doctor visits, lab work, or physical therapy, unless your Medicare supplement provides this benefit. Medicare providers can either accept Medicare's assigned rates for each service, or if they choose, they can charge you an excess charge that can be up to 15% above the assigned rates. This can be pricey for items like diagnostic imaging or surgery, so you can choose a Medicare supplement that covers this expense if you wish. Finally, since Medicare is a U.S. health insurance program, it does not offer you coverage outside our country, but some Medicare supplements include a foreign travel benefit that will pay 80% of your expenses up to $50,000 after a small deductible. By now you're probably asking yourself, how do I choose a Medicare supplement? Fortunately, since Medicare supplements are standardized, you will be able to select your supplement and know exactly which benefits you are purchasing. There are several factors which you will want to know about each insurance company before you choose your supplement, though. The first, of course, is rates. What premium are they offering to you, and is it competitively priced? Perhaps just as important as rates, though, is the rate trend history. Most Medicare supplements will have an annual rate increase to keep up with medical inflation. What kind of rate increases has each carrier you are considering had over the last 3 years? And are the rate increases reasonable or significantly higher than the competitors? Finally, you'll want to compare financial ratings. Insurance companies are analyzed by a number of different companies that dig into their financial stability and give reports or grades on the fiscal health of the insurer. Ask your agent what the AM Best and Weiss ratings are for each carrier you are considering, and then factor this information in when making your selection. To learn more about the specific Medicare supplement plans available in your area, visit www.boomerbenefits.com today and enter your zip code in the box at the top. We'll help you sort out the options and locate a Medicare supplement that will offer you the best coverage at the most affordable price. Boomer Benefits. We speak Medicare.